Hi, I'm Gina, lactation consultant with Newman Regional Health. August is National Breastfeeding Month. We are celebrating, along with all the people around the world, the amazing benefits of breastfeeding. We also want to encourage everyone around to continue to support our breastfeeding mothers. Here are a few of our moms who wanted to share their story regarding their breastfeeding journey.
Hi, my name is Stephanie, and this here's Vincent. He's about to turn 6 months old. We chose to exclusively breastfeed, and it was much more of a challenge than I had first anticipated. But we were able to reach our goals and meet our goals doing this by all the assistance and help that Newman Regional Health's breastfeeding clinic was able to provide. It was great to have the meeting that we could come to twice a week, or if I needed to arrange a time to come in, that we were able to do that. Between the support of them and the people at home, we were doing pretty fantastic. So,
hi, my name is Cassie, and this is my son Benjamin. He's 4 weeks old today. We have been breastfeeding since birth, and that was my goal starting out with this pregnancy, was to be able to breastfeed. My sister and mom both were very successful with their breastfeeding journeys, and so I had high hopes that we would be able to do so as well. And of course, I really wanted that connection with my baby that breastfeeding brings. We've had a few little troubles, struggles with some engorgement issues and stuff like that, but we've gotten through it with Gina's help, and we've been doing really, really well. He has grown really well. He started out a little bit underweight. The first day we took him home, he lost quite a bit of weight, and we came right back in and got things going. And he's been doing fantastic and is now almost 2 pounds over his birth weight. And so we're really, really happy with how that's been going. And so I just encourage anybody that is thinking about breastfeeding to really give it a try. There's nothing wrong with at least trying, because it really does give a really good connection, and it makes you feel very, very important in your baby's life, which of course you are already. But being able to have that bond and being able to share that time with your baby is something you'll never get back. And I just think that's really awesome, and it's a really great way to connect and bond with your baby.
My name is Brittany, and this is my wife, Tiffany. These are our twins. This is Finley, and this is Emery. When I got pregnant, there was really no other way for me to feed them other than breastfeeding. That's what I always, wanted to do. That's always what I thought I was going to do. I've got a sister that has a couple kids, and she always had really good luck with breastfeeding. So that's just always the way that I thought I would go. Anytime anybody would ask me, I would say, yeah, of course I'm breastfeeding. And then after I had them, they latched really well in that first golden hour, and I thought that everything was going really well. And they continued to latch, the next day or two. They had a few issues because they were pretty small, and they were losing a little bit of weight more than we were wanting them to. But we went home on a Saturday, and they screamed that entire first night, pretty much the entire time, because they were hungry and I wasn't making enough milk. And Gina, the lactation consultant, was really, really great. And she called Sunday, the day after we went home, and she called and asked how everything was going, and asked if we wanted to come in and see how they were doing. And I honestly thought things were going really well, that they were latching better, that I was finally getting the hang of things. But I decided to come in anyway and talk to Gina just to see, kind of make sure that they were doing as well as I thought they were. And turns out that Emery had lost about 11% of her body weight, and Finn had lost 10. And so that day, Gina worked with us on latching and getting him breastfeeding, but also decided that we needed to start supplementing with formula. And we haven't looked back since. So I haven't been able to exclusively breastfeed like I planned to. I haven't been able to make enough for the entire time. So we're formula feeding, and then I'm still pumping. And so they do get a couple bottles of breast milk a day. And so I definitely didn't meet my initial breastfeeding goals, but we made it work, and they're happy and they're healthy and they're gaining weight, and that's really all that matters. So I really had a great experience though, even though it didn't work out for me. Like the nurses were really great in helping me. It took 3 people to get, 2 babies latched at the same time, and all the nurses were really great about helping me do that and giving me tips for things that worked for them or things that didn't work for them. And then Gina has honestly been one of the best things ever, the lactation consultant. She always supportive of whatever we chose to do and has been super helpful and just super supportive. She really, I was really hard on myself when I couldn't breastfeed them exclusively, and she really helped me be okay with that. And so that's my advice to any new mom, that, don't be so hard on yourself. Like if it doesn't work out for you, as long as your babies are happy and fed, that's all that matters.
In the workplace, it is so important for employers to make breastfeeding moms feel safe and comfortable while they are pumping away from their infant. So creating a safe and comfortable area for pumping is crucial, as well as giving them pump breaks to allow them time to pump. All of us have an important role in providing support, promoting breastfeeding, and protecting breastfeeding. In the home setting, family members and spouses or partners are the biggest influence in continuing the support for breastfeeding moms. In the social setting, friendships and mom groups provide a listening ear to those moms who may have questions or just need someone to talk to. In public spaces, we want moms to feel supported and feel like they can breastfeed wherever they are. And it is mom's legal right to breastfeed in public. And here in Emporia, we have Breastfeeding Welcome Here, where a lot of our businesses have pledged to become breastfeeding friendly. And you may see a sticker like this on the outside of the business. We're very grateful that we have partnered with the City of Emporia to become more breastfeeding friendly. In the clinics or hospital setting, healthcare providers are instrumental in providing information to breastfeeding moms regarding feedings. We also have lactation consultants on staff so that we can continue to support and provide information to you along the way. At Newman Regional Health, we have Becoming a Mom prenatal classes for you to sign up and become part of before you deliver your baby. During hospitalization, we have an amazing group of nurses and physicians and lactation consultants who protect and help you get off to a good start with breastfeeding. After discharge, we also have the breastfeeding clinic and physicians post-op visits to help you along the way. As you can see, it truly takes a village to continue to support, encourage, and promote breastfeeding.